You're listening to Health Professional Radio. My name is Wayne Buckler, and today I'm joined by Imogen Hines. Now, Imogen's here to speak on behalf of the Australian Medical Students Association. They've got some events coming up, but she's also a doctor-to-be who's got an interesting story to tell about her interest in rural health. Imogen, welcome to the show.
Lovely to be here.
Now, Imogen, let's start with the rural health bit, and we'll work our way back to the health summit before we finish up. Now, you've got a very strong interest in rural health, but you're not a rural girl, is that right?
Yes, that's correct.
So you're a Sydney-sider by birth?
Yep, so I grew up in Sydney. I've lived in Sydney my entire life, but I spent a large part of my childhood travelling into country towns for sport. So I developed a bit of a love there.
It's kind of contrary to the story that I used to think was conventional wisdom, that the best way to get doctors into rural areas was to recruit them from rural areas as students, and you kind of run counter to that plan. How'd this fascination with living in rural areas come about?
For me, it probably started because I was travelling to rural areas for sport. So I did have exposure to sort of country towns and the lifestyle. But I also think that there's a growing body of students, particularly medical students and younger doctors, who come from the city who are interested in working rurally. It's become such not a good issue to have, but it's become such an issue that there's actually challenges with providing them with the opportunities they need. So a lot of it kind of comes from the professional exposure and the professional experiences that you get. Medicine is becoming increasingly subspecialised, and even in metropolitan areas, GPs are becoming less generalist and more specialist in primary care. So I think there's a real attraction to being able to be a doctor in the later 20th century idea of the term, where you're seeing a diverse caseload and a bunch of different patients with different conditions rather than performing appendectomies all day, every day. And then in Australia, at least, we're seeing a change in our cities. So the cities are we have a higher density living and becoming more expensive. So you're seeing a lot of medical students seeking out space and the community-minded nature that you have in a rural town.
And do you think that's specifically tied to general practice, or does that apply to acute care as well?
Oh, it definitely applies to acute care as well. Even within Sydney, you have trauma centres, and in the hospital and specialist settings, you'll see in a country town a neurologist is a neurologist, and they work with patients with Parkinson's, patients with motor neuron disease, patients with strokes, brain tumours, all sorts of different caseloads. Whereas in a metropolitan area, you'll be a neurologist who focuses on patients with Parkinson's disease, or you'll be a general surgeon who does hernia repairs. So there's definitely something that even within an acute care setting, within the emergency department, within psychiatry even, that you're starting to see in metropolitan areas that highly subspecialist work. And it's great from a patient care perspective because it means that doctors are very skilled and very competent in what they are doing. But for some people, that doesn't provide the same level of professional satisfaction that they would like.
It's an interesting perspective, and it's one that I didn't know was there. The kind of conventional wisdom I hear about is, the problem with rural practice is that you lack the support of specialists, you don't get the long-term care of critical patients, everyone's medevaced out, and so on and so forth. So it's quite different to the story you're telling.
Yeah, it's definitely different, I think, and it's something that's been changing over time, particularly with the focus on having rural referral hospitals. So there's large communities of doctors and specialists in major regional centres. But then you're also starting to see, for instance, over the summer break, I was in Nelson Bay, which is a coastal town in New South Wales, and they're starting to see radiologists and dermatologists and a whole bunch of specialists come into the town, which haven't previously been there before and which was work that was done by GPs in the past.
Very interesting. Now, tell us a little bit about the Australian Medical Students Association, and in particular, the Health Summit that you've got coming up.
Yeah, so the Australian Medical Students Association is an organisation that represents over 17,000 medical students in Australia from 21 different medical schools. And it's really quite a special organisation in that we're involved with advocacy for both medical students and patients. And a lot of our work involves meeting with politicians, formulating policies, government policies, and our own policies, which we can take to medical schools. But another component of AMSA is running events. So in September, we're having our annual Rural Health Summit, and that's being held in Albury. And the aim of the Rural Health Summit it's twofold. There's the focus on preparing students who already have an interest in rural health for rural practice by giving them the skills and the tools to be advocates for rural areas, but it also promotes rural practice and the rural lifestyle to students who might not yet be so convinced or don't know where they're planning on working in the future. So we have academic events, but there's also social events like a bush dance for the students and the delegates to really experience it all.
And how long does it run for?
It runs for 3 days. So we start on the Friday night with a gala dinner and a welcome to Albury that's being put on by Albury Council. And then over the next 2 days, we'll have academic sessions, social sessions, and a whole lot of different things going on. And it's a choose your own adventure conference this year, which means that the delegates get to choose what they want to do and what they feel would be best for their own professional development. And then it finishes on the Sunday afternoon.
Is there, Imogen, any opportunity for any of the medical suppliers or companies who are listening to sponsor the event?
Absolutely. So there are plenty of opportunities to get involved with sponsorship. We have a lot of sponsorship packages available, and it is a really great chance for medical suppliers, medical indemnity companies to come and meet medical students who are going to be their future clients and to take the opportunity to get in early, I suppose, and create brand recognition and brand awareness from the get-go. If you're interested in sponsoring us, you can definitely contact myself or our two conveners, Jordan and Dana, via email. I think, Wayne, you'll be putting our email addresses up.
Yeah, we will.
Yes, if they're interested, they can contact us. And AMSA also have a whole host of other events and committees that you can be involved in and with sponsorship.
And I guess for people who want some information in the first place, either about attending the summit or about sponsoring the summit, the AMSA ruralhealthsummit.com is probably the place to go. Now that's AMSA, AMSA, Rural Health Summit, all of that is one word, .com.
Yep, that's definitely the place to go.
Now, Imogen, it's been lovely having a chance to have a chat with you today. How many people do you think are going to turn up to the Health Summit?
We're looking at having 250 delegates, and then in addition to that, we have our organising committee, representatives from AMSA, and our academic speakers.
Oh dear, 300 medical students in one place. That could be a hoot, I think. Not that medical students have a reputation for partying or anything like that. That's just wrong to even assume that.
No, I think we have some very well-behaved medical students.
I think it'll be a great event. I do hope it goes well for you.
Thank you.
Imogen, it's been a pleasure having you with us. Thanks for giving up your time to have a talk to us today.
No worries. Thanks for having me.
If you just joined us, I've been chatting with Imogen Hines from the Australian Medical Students Association, and she's been talking about the increased migration, if that's the right word, the increased take-up of rural practice by doctors, and also about the Australian Medical Students Association Rural Health Summit that's coming up soon in rural Australia. And you can find details of that, as I mentioned earlier, at the AMSA ruralhealthsummit.com website. If you've missed that website, the good news is it's available on the transcript for the show. It's on our website. And it's also, the interview is also available as a podcast on iTunes and SoundCloud and YouTube, and you can listen to it there. If you are listening to us in social media, please click the buttons at the bottom of the screen, the likes, the shares, the subscribes, the smiley faces, even the frowny faces. We really do like to know you're listening. And if you've got questions either for Imogen Hines about the Australian Medical Students Association, or for us at the station, pop them into the boxes, the comments at any of the social media channels, and we monitor them all, and we'll either pass them on to Imogen or we'll get back to you ourselves. You're listening to Health Professional Radio. My name's Wayne Buckler. Thanks for being with us today.